All right, welcome to our fourth syndrome briefing. Let's get right into it.
Today, we're covering what is arguably the classic syndrome you're going to see on any dental exam. So yeah, this is absolutely high yield. You need to know this stuff.
The syndrome is Behçet disease. That's pronounced Behçet's. So what is it? At its heart, it's a multi-system disease that stems from an immunological issue.
Okay, so how do you diagnose it? The formula is really key here. You need to see oral ulcers plus any two of the following four signs: skin lesions, uveitis, which is inflammation in the eye, genital ulcers, or a positive pathology test. And that's just where the skin blisters when you stick it with a needle.
Now, here is the most critical takeaway. The diagnosis? It is purely clinical. I'll say it again, clinical only. There isn't some lab test that's going to give you the answer. It's all about recognizing the pattern.
That said, while there's no diagnostic test, there is one very important genetic marker that's strongly linked to it, and you've got to know this one: HLA-B51.
And check this out. The breakdown of who gets it is pretty fascinating. Look at the male to female ratio. In the Mediterranean, it's as high as 8-to-1. But then you go over to Europe, and it pretty much evens out to 1-to-1. Pretty wild difference.
So what's our job as clinicians? It really comes down to two simple steps. First, recognize this unique multi-system pattern. And second, and this is non-negotiable, you have to refer for multidisciplinary care. You do not manage this alone.
And there you have it, your high-yield briefing on Behçet's disease. Be sure to follow along for syndrome number 5.